Vitamin B12. Vitamin B12, cobalamin, plays a crucial role in the creation of red blood cells, as well as in cellular metabolism, the nervous system, and the production of DNA, molecules, and cells with genetic information. Dietary sources of vitamin B12 include poultry, meat, fish, and dairy products. Vitamin B12 is also added to some foods, such as fortified cereals, and is also available as an oral supplement. Vitamin B12 injections or nasal spray may be prescribed to treat vitamin B12 deficiency. Just because your body is in a state of capture for a certain number of years, vitamin B12 deficiency is very rare. However, if you are a vegetarian or vegan, you may be prone to a deficiency, as plant-based foods do not contain vitamin B12. Older people and people with gastrointestinal diseases that affect the rate of nutrient absorption are also prone to vitamin B12 deficiency. If left untreated, vitamin B12 deficiency can lead to anemia, fatigue, muscle weakness, bowel problems, nerve damage, and mood swings. The recommended daily amount of vitamin B12 for adults is 2.4 mcg. This study is about how to use vitamin B12, as well as for specific actions and circumstances, as shown below. Diseases of the heart and blood vessels. Scientists previously believed that this is due to vitamin B12, and in combination with folic acid, vitamin B9, vitamins A6, and in the prevention of heart and vascular diseases, by reducing the level of amino acids in the blood, which is healthy. However, studies show that the combination of these vitamins does not appear to reduce the risk of developing or worsening heart disease and stroke. Dementia. Vitamin B12 deficiency has been linked to illness and low cognitive function, but it is not clear whether vitamin B12 supplementation is intended to help prevent or cure dementia. Sports performance. If you are not deficient in vitamin B12, there is no evidence that vitamin B12 supplements increase your energy, or make you a better athlete. Generally safe, most people don't get enough vitamin B12 from a well-balanced diet. However, older adults, vegetarians, vegans, and people with medical conditions that affect their ability to absorb vitamin B12 from food can benefit from taking oral supplements. Vitamin B12 supplements are recommended only for pregnant women and nursing mothers, as well as those who follow a vegetarian or vegan diet. When taken at appropriate doses, vitamin B12 supplements are generally considered safe. While the recommended daily amount of vitamin B12 for adults is 2.4 mcg, higher doses were found to be safe. Your body only absorbs as much as you need, and the excess passes through your urine. High doses of vitamin B12, such as those that should be used to treat a deficiency, can lead to headache, nausea and vomiting, diarrhea, fatigue and weakness, tingling sensation in the hands and feet. Possible answers are aminosalicylic acid, PASR. The use of this drug is used in the treatment of problems with the digestive system and can reduce the body's ability to absorb vitamins B12. Colchicine, Colcrese, Mitigar, Gloperba. At the same time, anti-inflammatory drugs are used to prevent and treat attacks of gouty arthritis, and can also reduce the body's ability to absorb vitamin B12. Metformin, Glumetza, Fortimeth, etc. The use of this drug in diabetes mellitus can reduce the body's ability to absorb vitamin B12. Proton pump inhibitors. Taking omeprazole, Instagram, lansoprazole, Instagram, or other medications that reduce stomach acidity, which can reduce the body's ability to absorb B12 vitamins. Vitamin C, ascorbic acid. Taking vitamin B12 and vitamin C can reduce the total amount of vitamin B12 in the body. To avoid this interaction, you should take vitamin C within 2 hours of taking vitamin B12 supplements. Your doctor may recommend that you change the dosage of the drug or the time of administration to compensate for possible interactions.